Girl, naimbita ka ba sa binyag na anak mo Luna? Oo. Ikaw? Wait, teka lang. Nabalitaan ko may G6PD deficiency daw yung anak ni Luna. Ano yun? Search na. Search mo. Ano ba yun? Ito o video?
So what is G6PD deficiency? This is a genetic disorder that affects people's G6PD levels. G6PD stands for glucose 6-phosphate dehydrogenase. G6PD is an enzyme that protects your red blood cells from harmful substances. Deficiency happens when the gene that drives the G6PD enzyme mutates or changes so the enzyme can protect red blood cells.
Ah, yun pala yun. Eh, paano ko naman malalaman kung may G6PD ka?
Wait lang, search natin ulit.
Ito.
A child will only show symptoms of G6PD deficiency when the red blood cells are being broken down in excess. They may have pale skin, severe tiredness, dark-colored urine, and jaundice.
Naalala ko, ano kayang hindi pwedeng pagkain sa G6PD deficiency?
If a child is G6PD deficient, he or she should avoid foods like fava beans and all other kinds of beans, peanut butter, soy products, and blueberries. On the other hand, children with G6PD deficiency can eat natural foods like carrots, pumpkin squash, green papaya, and chayote.
Pero di ba wala pa siyang lunas? Oo, pero baka may maintenance naman nila. Siguro.
Treating a G6PD deficiency symptom is usually as simple as removing the trigger. Often, this means treating the infection or stopping the use of a certain drug. A child with severe anemia may need treatment in the hospital to get oxygen and fluids. Sometimes a child also needs a transfusion of healthy blood cells. The best way to care for a child with G6PD deficiency is to limit exposure to anything that triggers symptoms. Check with your doctor for instructions and a list of medicines and other things that could be a problem for a child with G6PD deficiency.
Parang kulang yung information na nasabi tungkol sa G6PD. Search ko nga ulit. Paano kaya natin malalaman kung may ganong sakit yung bata o tao?
So how is G6PD deficiency diagnosed? Your healthcare provider can diagnose G6PD deficiency with a simple blood test. You may need this test if your family comes from an area where this condition is common, you have a family history of G6PD deficiency, or you have an unknown form of anemia. Your provider may repeat tests to make an accurate diagnosis.
If your child is G6PD deficiency, remember that treatment is always prevention. If it's not treated adequately, then your child may result in severe anemia. So children with G6PD deficiency should avoid a lot of foods. So you actually need to look at the ingredients. When you buy a pack of nuts, you make sure that there's no fava beans or white broad beans. And the list would also include blueberries, red wine, and soy products. With regards to medication, there are certain medications which should be avoided, which should include your antimalarials, sulfa drugs, and specific antibacterials. There are certain dietary and medication restrictions that parents must adopt for their children in order to keep the condition from flaring up. Your doctor will provide you with this list of food and certain medications to avoid to make sure that your child would live a normal life.
Nursing interventions for G6PD deficiency patients are the following: assess and monitor laboratory results, assess and monitor activity intolerance, encourage increased dietary intake of the deficient nutrient, which may be iron, vitamin B12, or folic acid, administer medications as prescribed, and instruct the client on side effects. Medications such as iron supplements.
I know